Are different types of pain treated differently?
Yes, and that's very important. That's something you want to talk to your pain provider or physician about. If you just treat pain one way, you're probably not going to get a satisfactory answer to it, and you're not going to. You need to take into account the individual. So one person's pain management or management of the pain is going to be very different than somebody else's, and there are different sources of pain. So we want to treat the source of pain. We're going to do much better than just putting a blanket over. So in ankylosing spondylitis and spondylitis patients who experience pain, we often have different sources of those pain. One of them could be enthesitis, which means inflammation of the tendons or muscles as they insert upon the bone. And to treat that, we want to use very specific therapy. So some of them may include oral anti-inflammatory drugs, such as the nonsteroidal agents, or the COX-2 inhibitors, such as acetacoxib. But also other modalities are helpful for that type of pain, which may be physical therapy, physical modalities such as heat, TENS unit, ultrasound therapy can be helpful, as well as interventional pain management, such as injections of peripheral corticosteroids or local anesthetics. When we have other types of pain called neuropathic pain, that means pain that originates from a nerve source itself, whether it be a peripheral nerve or a nerve that's more closer to the spinal cord. And so often those pain can be treated with different types of medications, such as anti-seizure medications or medications that block something called the calcium channel, such as gabapentin. When we move into other sources of pain, such as central pain, and central pain can be pain that originates from the spinal cord or from the brain, or sometimes from the neurotransmitters that are involved in the brain or spinal cord. And one of the common things we see is patients who experience fibromyalgia type pain or myositis or myalgia type pain. We know that there's some aberrant levels of neurotransmitters. One of them is called serotonin or norepinephrine in those patients. So using medications and management that targets those types of things are much better than using some of the other modalities. And then other sorts of pain, such as somatic pain, the pain that we all experience when we either burn ourselves or we break a bone, and we treat those modalities differently.